Question 1. The audit findings indicate a recurring pattern of patients experiencing preventable hospital readmissions due to unmet social needs, such as food insecurity and lack of stable housing. As a practical nurse, what is the most appropriate initial approach to address this systemic issue within your patient population? Option A. Document the audit findings in the patient charts and wait for specific physician orders to address any identified social needs before taking action. Option B. Focus solely on providing direct clinical care and educating patients on their medical conditions, assuming that social issues are outside the scope of practical nursing responsibilities. Option C. Implement routine screening for social determinants of health during patient assessments and establish a process for referring identified patients to appropriate community resources and social services. Option D. Advocate for the hiring of additional social workers to manage all patient social needs, as this falls outside the practical nurse's primary role. Correct answer is C. Implement routine screening for social determinants of health during patient assessments and establish a process for referring identified patients to appropriate community resources and social services. Explanation: this scenario is professionally challenging because it requires the practical nurse to move beyond direct clinical care to address systemic issues impacting patient well-being. The audit findings highlight a gap in addressing social determinants of health (SDO), which are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Practical nurses, within their scope of practice as defined by the National Council Licensure Examination (NCLEX) framework, are expected to contribute to patient care by recognizing and responding to these factors. The correct approach represents best professional practice because it involves a proactive and collaborative strategy to identify and mitigate the impact of SDO on patient health outcomes. This aligns with the NCLEX emphasis on patient-centered care and the nurse's role in advocating for patients. Specifically, it involves integrating screening for SDO into routine care, which is a recognized best practice for identifying patients at risk. Furthermore, it emphasizes connecting patients with appropriate community resources, which is a crucial step in addressing the identified social needs and improving overall health. This approach is ethically sound, promoting patient well-being and health equity, and is consistent with the professional standards expected of licensed practical nurses. An incorrect approach that involves solely focusing on the patient's immediate clinical needs without acknowledging or addressing the underlying social determinants fails to provide holistic care. This is a regulatory and ethical failure because it neglects a significant factor contributing to the patient's health status and potential for readmission or poor outcomes. It demonstrates a lack of understanding of the broader context of health and disease, which is a core competency assessed by the NCLEX. Another incorrect approach, which involves dismissing the audit findings as outside the scope of practical nursing, is a direct contravention of professional responsibility and regulatory expectations. The NCLEX framework explicitly includes questions related to recognizing and responding to psychosocial and environmental factors that influence health. Failing to address SDO is a failure to advocate for the patient and to provide comprehensive care, potentially leading to patient harm and violating ethical principles of beneficence and non-maleficence. A third incorrect approach, which suggests waiting for physician orders to address social needs, is also professionally unacceptable. While collaboration with the interdisciplinary team is vital, practical nurses are expected to use their clinical judgment to identify patient needs, including those related to SDO, and to initiate appropriate interventions within their scope of practice, or to advocate for further assessment and intervention. Relying solely on physician orders for every aspect of patient care, especially concerning psychosocial and environmental factors, can lead to delays in care and unmet patient needs, which is a failure in professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the patient's situation within the broader context of their life and environment. 2. Identify potential social determinants of health that may be impacting their current health status. 3. Assess the patient's needs related to these determinants, utilizing appropriate screening tools or direct questioning. 4. Determine interventions that are within the practical nurse's scope of practice, such as education, resource referral, or advocacy. 5. Collaborate with the interdisciplinary team to ensure comprehensive care. 6. Document all assessments and interventions accurately. Question 2. Stakeholder feedback indicates a need to clarify the distinction between medical and nursing diagnoses in the practical nursing curriculum. A patient is admitted with a physician's diagnosis of pneumonia. Which of the following best represents a nursing diagnosis that a practical nurse would formulate based on this medical diagnosis? Option A. Impaired gas exchange related to alveolar pneumonic consolidation. Option B. Pneumonia. Option C. Bronchitis. Option D. Acute respiratory infection. The correct answer is A. Impaired gas exchange related to alveolar pneumonic consolidation. Explanation. This scenario is professionally challenging because it requires the practical nurse, PN, to differentiate between two distinct but related diagnostic processes, medical diagnosis and nursing diagnosis. A medical diagnosis identifies a disease or condition, while a nursing diagnosis describes a patient's response to a health problem or life process. Misinterpreting this distinction can lead to ineffective or inappropriate care planning, potentially violating the nurse's duty of care and the standards set by the National Council of State Boards of Nursing, NCSBN, for practical nursing practice. The correct approach represents best professional practice because it accurately reflects the PN's scope of practice as defined by NCSBN guidelines. PNs are educated to identify and manage patient responses to health issues, which is the domain of nursing diagnoses. By focusing on the patient's actual or potential health problems that nurses can treat, the PN is adhering to the nursing process and providing patient-centered care. This aligns with the ethical obligation to provide competent care and the regulatory requirement to practice within the defined scope of licensure. An incorrect approach that focuses solely on the medical diagnosis fails to recognize the PN's role in assessing and addressing the patient's subjective and objective responses to that diagnosis. This can lead to a care plan that is disease-focused rather than patient response-focused, potentially overlooking critical nursing interventions. It may also represent a failure to utilize critical thinking skills in developing a comprehensive plan of care, which is a core competency expected of licensed nurses. Another incorrect approach might involve making a medical diagnosis, which is outside the scope of practice for a PN and constitutes practicing beyond the limits of licensure, a serious regulatory violation. The professional reasoning process for similar situations involves a systematic approach. First, identify the patient's medical diagnosis as provided by the physician. Second, critically analyze the patient's signs, symptoms, and subjective reports to determine their response to that medical diagnosis. Third, formulate a nursing diagnosis that accurately describes this patient response. Fourth, develop nursing interventions aimed at addressing the nursing diagnosis, thereby supporting the patient's overall well-being and recovery, while always collaborating with the healthcare team and respecting the physician's medical diagnosis. Question 3. The risk matrix shows a moderate risk associated with administering a new pain medication to a patient with a history of respiratory issues. The physician has ordered the medication. What is the most appropriate immediate nursing action? Option A. Assess the patient's current respiratory status, vital signs, and review the medication's potential side effects and contraindications before administering. Option B. Document the medication as administered and then check the patient's respiratory status. Option C. Ask an unlicensed assistive personnel to check the patient's breathing sounds before administering the medication. Option D. Administer the pain medication immediately to alleviate the patient's discomfort. The correct answer is A. Assess the patient's current respiratory status, vital signs, and review the medication's potential side effects and contraindications before administering. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the practical nurse to balance the immediate need for patient comfort with the potential for adverse drug reactions, all while adhering to established protocols and patient safety guidelines. The risk matrix highlights the importance of proactive identification and mitigation of potential harm, demanding careful judgment in prioritizing interventions. Correct approach analysis. The correct approach represents best professional practice because it aligns with the fundamental nursing principle of patient safety and the regulatory framework governing practical nursing practice in the United States, as outlined by the National Council of State Boards of Nursing, NCSBN. This approach prioritizes a thorough assessment of the patient's current status and potential contraindications before administering medication. It reflects the nurse's responsibility to advocate for the patient by ensuring the medication is appropriate and safe, thereby preventing potential harm and upholding the ethical obligation to do no harm. This aligns with the NCSBN emphasis on safe and effective nursing care. Incorrect approach is analysis. Administering the medication immediately without further assessment fails to uphold the principle of patient safety and violates the regulatory expectation that nurses conduct a thorough assessment prior to medication administration. This could lead to adverse drug events, contravening the NCSBN focus on preventing harm. Delegating the assessment to another unlicensed assistive personnel without direct supervision or verification of their competency in medication-related assessments is a breach of professional responsibility. Practical nurses are accountable for the safe administration of medications and cannot abdicate this responsibility. This failure to directly supervise and assess the patient's suitability for the medication is a regulatory and ethical lapse. Documenting the medication as administered before confirming the patient's readiness and absence of contraindications is falsification of records and a serious ethical and regulatory violation. Accurate and timely documentation is crucial for continuity of care and patient safety, and preemptive documentation undermines these principles. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including a review of the patient's medical history, allergies, and current condition. This is followed by a verification of the medication order, ensuring it is appropriate for the patient's needs and free from contraindications. The nurse must then consider the potential risks and benefits of the medication, consulting with the supervising registered nurse or physician if any concerns arise. Finally, the nurse must document the administration accurately and in a timely manner, reflecting the patient's response. This structured approach ensures patient safety and adherence to regulatory standards. Question 4. System analysis indicates that a practical nurse is providing care to a patient with a diagnosis of pneumonia. The established care plan includes monitoring vital signs every 4 hours, administering prescribed antibiotics, and encouraging fluid intake. During the morning assessment, the practical nurse notes that the patient's respiratory rate has increased from 20 to 28 breaths per minute, and the patient is now reporting increased shortness of breath and is hesitant to cough. The practical nurse has also observed that the patient's skin is cooler and drier than usual. Which of the following actions best reflects appropriate modification of the care plan based on this evaluation? Option A. Continue with the current care plan, as the patient's condition is within expected parameters for pneumonia. Option B. Document the observed changes but take no further action until the next scheduled assessment. Option C. Immediately adjust the antibiotic dosage and frequency without consulting the registered nurse or physician. Option D. Reassess the patient's respiratory status, gather further data, and report the findings and concerns to the registered nurse for collaborative revision of the care plan. The correct answer is A. Continue with the current care plan, as the patient's condition is within expected parameters for pneumonia. Explanation. Scenario analysis. This scenario presents a common challenge in practical nursing, where a patient's condition deviates from the expected outcome outlined in the care plan. The professional challenge lies in accurately interpreting the new data, understanding its implications for the patient's well-being, and making timely, evidence-based modifications to the care plan. This requires critical thinking, a thorough understanding of the patient's baseline, and knowledge of expected physiological responses and potential complications. The nurse must balance the need for prompt intervention with the requirement to follow established protocols and communicate effectively with the healthcare team. Correct approach analysis. The correct approach involves a systematic process of reevaluation and modification. Upon observing a change in the patient's condition, the practical nurse must first gather more data to confirm the observation and understand its extent. This is followed by analyzing this new data in the context of the existing care plan and the patient's overall health status. The nurse then collaborates with the registered nurse or healthcare provider to discuss the findings and propose necessary adjustments to the care plan. This collaborative approach ensures that modifications are appropriate, safe, and aligned with the overall treatment strategy, adhering to the principles of patient-centered care and professional accountability as outlined by the National Council of State Boards of Nursing, NCSBN. Standards for practical nursing practice. Incorrect approaches analysis. Failing to reevaluate the patient's condition after observing a change is a direct violation of the nursing process and professional responsibility. It implies a lack of vigilance and can lead to delayed or missed interventions, potentially harming the patient. This neglect of duty is contrary to the ethical obligation to provide safe and competent care. Implementing changes to the care plan without consulting the registered nurse or healthcare provider is a significant breach of professional boundaries and regulatory guidelines. Practical nurses operate under the supervision of registered nurses and physicians. Unauthorized modifications can lead to unsafe practices, conflicting treatments, and a breakdown in the continuity of care, which is a failure to adhere to the scope of practice defined by state nursing practice acts. Continuing with the original care plan without any adjustment, despite clear evidence of patient deterioration or a change in needs, demonstrates a failure to critically analyze data and adapt care. This can be interpreted as negligence, as the nurse is not responding appropriately to the patient's evolving condition, thereby failing to meet the standard of care expected of a licensed practical nurse. Professional reasoning. The professional decision-making process in this situation involves a cyclical application of the nursing process: assessment, diagnosis, planning, implementation, and evaluation. When evaluation reveals a deviation, the cycle restarts with a more focused assessment, leading to a revised diagnosis and plan. Key steps include: 1. Recognize and validate the change in patient status. 2. Gather comprehensive data to understand the nature and severity of the change. 3. Analyze the data in relation to the existing care plan and patient's condition. 4. Communicate findings and concerns to the appropriate healthcare professional, e.g., RN, physician. 5. Participate in the collaborative process of revising the care plan based on the new information. 6. Implement the revised plan and continue to evaluate its effectiveness. This systematic and collaborative approach ensures patient safety and adherence to professional standards. Question 5. The monitoring system demonstrates that Mr. Smith, a 78-year-old male, has an oxygen saturation of 85% with labored breathing and audible wheezing. Mrs. Jones, a 65-year-old female, is reporting moderate incisional pain rated at 6/10 and is requesting pain medication. Mr. Brown, a 55-year-old male, is refusing to get out of bed due to fear of falling, and Ms. White, a 40-year-old female, requires assistance with bathing and dressing due to recent surgery. As the sole practical nurse on duty, which nursing diagnosis requires your immediate attention? Option A, risk for falls related to fear of falling. Option B, impaired gas exchange related to bronchospasm. Option C, self-care deficit related to surgical recovery. Option D, acute pain related to surgical incision. The correct answer is B, impaired gas exchange related to bronchospasm. Explanation. This scenario presents a professional challenge due to the conflicting needs of multiple patients, requiring the practical nurse to apply the principles of prioritization based on established nursing diagnoses and the urgency of their associated risks. The ethical dilemma arises from the limited resources, the nurse's time and attention, and the imperative to provide safe and effective care to all patients. Careful judgment is required to identify the most immediate threat to life or well-being, aligning with the nurse's ethical and legal obligations. The correct approach represents best professional practice because it prioritizes the nursing diagnosis that addresses the most life-threatening condition, which is impaired gas exchange. This aligns with the fundamental principle of Maslow's hierarchy of needs, where physiological needs, oxygenation, take precedence. The Nurse Practice Act for Practical Nurses mandates that nurses provide care that is safe and within their scope of practice, which includes recognizing and responding to emergent situations. Prioritizing based on the most critical physiological need ensures that immediate threats to life are addressed first, thereby upholding the ethical duty to do no harm and to act in the best interest of the patient. An incorrect approach that prioritizes a nursing diagnosis related to pain management over impaired gas exchange fails to recognize the immediate threat to life. While pain is a significant concern, it is generally not as immediately life-threatening as severe respiratory distress. This approach could violate the Nurse Practice Act by failing to provide timely and appropriate care for a critical condition, potentially leading to adverse patient outcomes and a breach of professional responsibility. Another incorrect approach that prioritizes a nursing diagnosis related to mobility issues over impaired gas exchange demonstrates a failure to assess and prioritize based on physiological urgency. Mobility issues, while important for patient comfort and long-term recovery, do not typically represent an immediate threat to life compared to compromised breathing. This oversight could lead to a delay in critical interventions, violating the nurse's duty to provide safe and effective care, and potentially contravening regulatory standards for emergency response. An incorrect approach that prioritizes a nursing diagnosis related to self-care deficit over impaired gas exchange is also professionally unacceptable. Self-care deficits, while requiring nursing intervention, are generally not as critical as a life-threatening respiratory issue. Focusing on less urgent needs when a patient is experiencing a severe impairment in gas exchange would be a failure to adhere to the principles of triage and prioritization, potentially leading to a deterioration of the patient's condition and a violation of the Nurse Practice Act's mandate for safe patient care. The professional decision-making process for similar situations involves a systematic assessment of all patients, identification of nursing diagnoses, and prioritization based on the urgency of the physiological threat. This process should involve applying established nursing principles, such as Maslow's hierarchy of needs, and adhering to the scope of practice and legal mandates outlined in the Nurse Practice Act. The nurse must continuously reevaluate patient conditions and adjust priorities as needed, always aiming to provide the highest level of care within their capabilities. Question 6. The efficiency study reveals that the current method of administering patient medications on the medical surgical unit is time-consuming and has a higher-than-average rate of minor documentation errors. Which of the following actions best addresses these findings while upholding professional nursing standards? Option A. Request additional nursing staff to alleviate the workload, assuming this will naturally reduce documentation errors. Option B. Implement a standardized electronic medication administration record (EMR) system with barcode scanning technology and provide comprehensive staff training on its use. Option C. Focus solely on improving the speed of medication delivery, with documentation being a secondary concern once efficiency is achieved. Option D. Organize a mandatory staff meeting to discuss the study findings and encourage individual nurses to find their own solutions to improve efficiency. The correct answer is B. Implement a standardized electronic medication administration record (EMR) system with barcode scanning technology and provide comprehensive staff training on its use. Explanation. The efficiency study reveals that the current method of administering patient medications on the medical surgical unit is time-consuming and has a higher-than-average rate of minor documentation errors. This scenario is professionally challenging because it directly impacts patient safety, staff workload, and adherence to regulatory standards for accurate record-keeping. Practical nurses are entrusted with the critical responsibility of medication administration and documentation, requiring a balance between efficiency and meticulous accuracy. Careful judgment is required to identify and implement improvements that enhance patient care without compromising safety or violating professional standards. The correct approach involves a systematic review of the medication administration process, identifying specific bottlenecks and error-prone steps, and then proposing evidence-based interventions. This aligns with the National Council Licensure Examination for Practical Nurses, NCLEX-PN, focus on safe and effective care. Best professional practice dictates that practical nurses actively participate in quality improvement initiatives, utilizing critical thinking to assess workflow, identify risks, and implement solutions that are compliant with state nurse practice acts and facility policies, which emphasize accurate and timely documentation as a legal and ethical imperative. An incorrect approach would be to dismiss the study's findings due to staff resistance or a perceived lack of time. This fails to acknowledge the potential for patient harm and violates the ethical obligation to provide safe care. It also disregards the regulatory requirement for accurate and complete patient records, which are essential for continuity of care and legal protection. Another incorrect approach would be to implement a new system without adequate training or evaluation, potentially introducing new errors or inefficiencies. This demonstrates a lack of due diligence and a failure to consider the practical implications of change, which can lead to patient safety issues and noncompliance with facility protocols and nursing standards. Professionals should approach such situations by first understanding the root causes of the identified inefficiencies and errors. This involves open communication with the team, data analysis, and a review of current policies and procedures. The decision-making process should then focus on selecting interventions that are evidence-based, feasible to implement, and demonstrably improve both efficiency and accuracy, while always prioritizing patient safety and regulatory compliance. Question 7. Process analysis reveals a licensed practical nurse is assigned to care for a patient presenting with a cough, fever, and shortness of breath. The patient's symptoms are highly suggestive of a potentially airborne transmitted illness. Based on the National Council Licensure Examination for Practical Nurses Regulatory Framework, which of the following nursing actions is the most appropriate initial response to ensure patient and staff safety? Option A. Implement airborne precautions, including requiring the nurse to wear an N95 respirator, placing the patient in an airborne infection isolation room, IR, with negative pressure, and ensuring the patient wears a surgical mask when leaving the room. Option B. Utilize contact precautions, ensuring the nurse wears gloves and a gown, and place the patient in a private room with standard ventilation. Option C. Place the patient in a private room with good ventilation, and have the nurse wear a standard surgical mask and gloves during direct patient care. Option D. Administer routine nursing care, focusing on meticulous hand hygiene, as the patient's symptoms are not yet confirmed as a specific infectious disease. The correct answer is A. Implement airborne precautions, including requiring the nurse to wear an N95 respirator, placing the patient in an airborne infection isolation room, IR, with negative pressure, and ensuring the patient wears a surgical mask when leaving the room. Explanation. Scenario analysis. This scenario presents a common but critical challenge in healthcare: ensuring patient safety and preventing the spread of infection when a patient exhibits symptoms suggestive of a highly contagious respiratory illness. The professional challenge lies in accurately assessing the risk, implementing appropriate precautions, and communicating effectively with the healthcare team and patient, all while adhering to established protocols. The nurse must balance the need for immediate action with the potential for patient discomfort or anxiety caused by isolation. Correct approach analysis. Implementing airborne precautions, including a well-fitting N95 respirator for the nurse, placing the patient in an airborne infection isolation room, IR, with negative pressure, and requiring the patient to wear a surgical mask when outside the room, represents best professional practice. This approach is directly aligned with the Centers for Disease Control and Prevention, CDC, guidelines for preventing the transmission of airborne pathogens, which are the standard for practical nursing practice in the United States. These guidelines are designed to minimize the risk of exposure to infectious agents that can remain suspended in the air for extended periods. Adherence to these protocols is a regulatory requirement for licensed practical nurses to protect both patients and healthcare personnel. Incorrect approaches analysis. Administering routine care without additional precautions and relying solely on hand hygiene fails to address the potential for airborne transmission, violating CDC guidelines and potentially exposing other patients and staff to a serious infection. This represents a significant ethical failure in the duty to protect vulnerable individuals. Using a standard surgical mask for the nurse and placing the patient in a regular room, even with good ventilation, is insufficient for airborne precautions. Airborne pathogens can penetrate standard surgical masks, and a regular room does not provide the necessary negative pressure to contain airborne particles within the patient's environment. This approach demonstrates a lack of understanding of transmission-based precautions and a failure to meet professional standards of care. Placing the patient in a contact isolation room and using gloves and a gown for care addresses only contact transmission. While contact precautions are important, they do not protect against airborne pathogens. This approach overlooks the primary mode of transmission suggested by the patient's symptoms and therefore fails to adequately prevent infection spread. Professional reasoning. When faced with a patient exhibiting symptoms of a potentially airborne illness, the licensed practical nurse should follow a systematic decision-making process. This begins with a thorough assessment of the patient's signs and symptoms. Next, the nurse must consult established guidelines, such as those from the CDC, to determine the appropriate transmission-based precautions. This involves identifying the likely mode of transmission, airborne, droplet, or contact, and the corresponding personal protective equipment, PPE, and environmental controls required. Effective communication with the charge nurse, physician, and other members of the healthcare team is crucial to ensure coordinated care and adherence to the isolation protocol. Finally, The nurse must educate the patient about the reason for the precautions and how they will be implemented, fostering cooperation and reducing anxiety. Question 8. Strategic planning requires a practical nurse to assess a situation where a competent adult patient refuses a prescribed medication that the nurse believes is essential for their well-being. Which of the following actions best reflects a risk assessment approach aligned with legal and ethical nursing practice? Option A. Engage the patient in a discussion to understand the reasons for their refusal, assess their understanding of the medication's purpose and risks, and explore alternative interventions or modifications with the healthcare team. Option B. Document the patient's refusal and inform the physician, then await further orders without further discussion with the patient. Option C. Proceed with administering the medication, explaining to the patient that it is for their own good and they will understand later. Option D. Immediately contact the patient's family to explain the situation and request they convince the patient to take the medication. The correct answer is B. Document the patient's refusal and inform the physician, then await further orders without further discussion with the patient. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a conflict between a patient's expressed wishes and a perceived need for intervention based on the nurse's assessment. The nurse must navigate the patient's autonomy, the legal and ethical duty to provide care, and the potential for harm if the patient's wishes are disregarded or if the nurse acts without proper justification. The risk assessment framework is crucial here to ensure that any decision made is grounded in patient safety and professional accountability, adhering to the Nurse Practice Act and ethical codes. Correct approach analysis. The correct approach involves a thorough risk assessment that prioritizes patient safety and respects patient autonomy within legal and ethical boundaries. This means gathering comprehensive information about the patient's condition, understanding the rationale behind the patient's refusal, and exploring alternatives. Documenting the assessment, the patient's decision-making capacity, and the interventions discussed is paramount. This aligns with the Nurse Practice Act's mandate to provide safe and competent care, which includes respecting patient rights and informed consent, and the ethical principle of beneficence balanced with respect for autonomy. Incorrect approaches analysis. One incorrect approach involves immediately overriding the patient's refusal and proceeding with the intervention. This violates the patient's right to self-determination and informed consent, which are fundamental legal and ethical principles. Such an action could lead to a battery claim and a violation of the Nurse Practice Act's provisions on patient rights and professional conduct. Another incorrect approach is to simply document the refusal without further assessment or exploration of the patient's reasoning. This fails to fulfill the nurse's duty to assess and intervene when a patient's safety may be compromised. It neglects the ethical obligation of beneficence and could be considered a breach of the standard of care, potentially violating the Nurse Practice Act's requirements for patient assessment and care planning. A third incorrect approach is to seek immediate physician orders to force the intervention without first attempting to understand the patient's perspective or exploring less restrictive options. While physician orders are important, they do not negate the need for the nurse to conduct an independent assessment and engage in therapeutic communication with the patient. This approach bypasses crucial steps in patient advocacy and shared decision-making, potentially leading to a breakdown in the nurse-patient relationship and a failure to uphold ethical obligations. Professional reasoning. Professionals should utilize a structured decision-making process that begins with a comprehensive assessment of the patient's situation, including their capacity to make decisions. This involves active listening, therapeutic communication, and a thorough understanding of the patient's values and preferences. If there is a conflict, the nurse should consult with the healthcare team, including the physician, to explore all available options and ensure the patient's rights are protected while their safety is maintained. Documentation should reflect each step of this process. Question 9. The evaluation methodology shows that a licensed practical nurse is caring for an elderly patient with multiple chronic conditions, including diabetes, hypertension, and early-stage dementia. The patient is experiencing increasing difficulty with self-care activities and expresses feelings of isolation. The nurse is tasked with developing a care plan that addresses these multifaceted needs. Which application of nursing theory best guides the practical nurse's approach? Option A. Applying a nursing theory that the nurse finds personally familiar and easy to implement, regardless of its direct relevance to the patient's specific diagnosis or psychosocial state. Option B. Adopting a nursing theory that is primarily focused on the theoretical underpinnings of advanced research in nursing, which the nurse believes demonstrates a high level of professional engagement. Option C. Utilizing a nursing theory that focuses primarily on acute illness management, as this is a common area of nursing intervention, even if the patient's primary issues are chronic and psychosocial. Option D. Selecting a nursing theory that emphasizes adaptation and self-care, focusing on empowering the patient to manage their chronic conditions and maintain independence as much as possible, while also addressing their social and emotional well-being. The correct answer is D. Selecting a nursing theory that emphasizes adaptation and self-care, focusing on empowering the patient to manage their chronic conditions and maintain independence as much as possible, while also addressing their social and emotional well-being. Explanation. This scenario presents a common challenge in practical nursing, translating theoretical knowledge into effective patient care. The professional challenge lies in identifying the most appropriate nursing theory to guide the care plan for a patient with complex, chronic needs, ensuring that the chosen theory directly addresses the patient's unique situation and promotes optimal outcomes within the scope of practical nursing practice. Careful judgment is required to select a theory that is both relevant and actionable. The correct approach represents best professional practice because it prioritizes a patient-centered, evidence-based selection of a nursing theory. By considering the patient's specific needs, the practical nurse can choose a theoretical framework that best supports their well-being, autonomy, and adaptation to their condition. This aligns with the core principles of nursing, which emphasize holistic care and patient advocacy, as outlined in the Nurse Practice Act and relevant professional nursing standards that guide practical nursing practice in the United States. An incorrect approach that focuses solely on the nurse's personal preference for a theory fails to meet professional standards. This is because patient care must be individualized and evidence-based, not dictated by the nurse's comfort level with a particular theory. Such an approach could lead to a care plan that is not optimally suited to the patient's needs, potentially compromising their care and violating ethical principles of beneficence and non-maleficence. Another incorrect approach, which involves applying a theory without understanding its core tenets or how it relates to the patient's situation, is also professionally unacceptable. This demonstrates a superficial understanding of nursing theory and a failure to engage in critical thinking. It can result in the misapplication of interventions, leading to ineffective care and potentially harming the patient. This disregards the requirement for competent and knowledgeable nursing practice mandated by regulatory bodies. Finally, an approach that relies on outdated or irrelevant theories ignores the evolution of nursing science and best practices. This can lead to the use of interventions that are no longer considered effective or even safe, failing to uphold the standard of care expected of a licensed practical nurse. Regulatory guidelines emphasize the importance of staying current with evidence-based practice. The professional reasoning process for similar situations involves 1. Thorough patient assessment to identify current and potential needs, strengths, and challenges. 2. Reviewing available nursing theories and their applicability to the identified patient needs. 3. Selecting the theory that provides the most comprehensive and practical framework for guiding interventions. 4. Collaborating with the registered nurse and other healthcare team members to integrate the chosen theory into the patient's care plan. 5. Continuously evaluating the effectiveness of the care plan and making adjustments as needed, informed by the chosen theoretical framework. Question 10. Assessment of a patient's refusal of a prescribed antihypertensive medication presents an ethical challenge for a practical nurse. The patient states they feel fine and do not want to take the medication today. The nurse needs to determine the most appropriate course of action according to the National Council Licensure Examination for Practical Nurses Regulatory Framework. Option A. Administer the medication as prescribed, overriding the patient's verbal refusal based on the nurse's professional judgment that it is in the patient's best interest. Option B. Engage the patient in a discussion to understand their reasons for refusal, assess their comprehension of the medication's purpose and potential consequences of not taking it, and document the interaction and decision. Option C. Document that the medication was refused by the patient and proceed with other patient care without further investigation or discussion. Option D. Immediately report the patient's refusal to the charge nurse and request that another nurse administer the medication. Correct answer is B. Engage the patient in a discussion to understand their reasons for refusal, assess their comprehension of the medication's purpose and potential consequences of not taking it, and document the interaction and decision. Explanation. Scenario analysis. This scenario presents an ethical dilemma common in practical nursing, where a nurse must balance patient autonomy with the nurse's professional responsibility to ensure safe medication administration. The challenge lies in respecting the patient's right to refuse medication, even if the nurse believes it is in the patient's best interest, while also adhering to the prescribed treatment plan and legal/regulatory requirements for medication management. The nurse must assess the patient's capacity to make such a decision and understand the potential consequences of refusal. Correct approach analysis. The correct approach involves a thorough assessment of the patient's understanding and capacity to refuse the medication. This aligns with the ethical principle of patient autonomy and the legal framework governing healthcare, which emphasizes informed consent and the patient's right to refuse treatment. The nurse must explain the medication's purpose, potential benefits, and risks of refusal in clear, understandable language. If the patient demonstrates understanding and capacity, their refusal must be respected and documented. This approach upholds professional standards of care and patient rights as outlined by the National Council of State Boards of Nursing, NCSBN, guidelines for practical nurses, which stress patient advocacy and safe medication practices. Incorrect approaches analysis. Administering the medication against the patient's expressed wishes, even if the nurse believes it is for the patient's benefit, constitutes a violation of patient autonomy and could be considered battery. This disregards the patient's right to self-determination, a fundamental ethical and legal principle in healthcare. Ignoring the patient's refusal and documenting that the medication was given without further assessment or discussion fails to address the patient's concerns and bypasses the necessary steps for informed consent or refusal. This is a failure in professional documentation and patient advocacy. Immediately reporting the patient to a supervisor without first attempting to understand the reason for refusal and assess their capacity is an overreaction that undermines the nurse-patient relationship and the nurse's own professional judgment. While escalation is sometimes necessary, it should follow a thorough initial assessment. Professional reasoning. Professionals should employ a systematic decision-making process when faced with such dilemmas. This involves 1. Identifying the ethical and legal issues, patient autonomy vs. nurse's duty of care. 2. Gathering information, assessing patient's understanding, capacity, and reasons for refusal. 3. Evaluating alternatives, discussing, educating, documenting, and escalating if necessary. 4. Making a decision based on professional standards, ethical principles, and legal requirements. 5. Documenting the process and outcome thoroughly. Question 11. Comparative studies suggest that the most effective strategy for preventing the transmission of healthcare-associated infections in a practical nursing setting involves a multifaceted approach to infection control. Considering the regulatory framework for the National Council Licensure examination for practical nurses, which of the following actions best exemplifies adherence to these principles when providing routine care to a patient with an unknown infection status? Option A. Wearing gloves only when directly administering medications, assuming other tasks pose minimal risk. Option B. Disposing of all used patient care items, including wrappers and disposable equipment, in the nearest available trash receptacle. Option C. Implementing standard precautions for all patient interactions, including the use of personal protective equipment, PPE, when indicated and meticulous hand hygiene before and after patient contact. Option D. Performing hand hygiene only at the end of a shift to conserve time and resources. The correct answer is C. Implementing standard precautions for all patient interactions, including the use of personal protective equipment, PPE, when indicated and meticulous hand hygiene before and after patient contact. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practical nurse to balance immediate patient needs with the overarching mandate of preventing healthcare-associated infections. The pressure to provide care quickly can sometimes lead to shortcuts that compromise infection control protocols. Adherence to established guidelines is paramount to patient safety and regulatory compliance, making careful judgment essential. Correct approach analysis. Implementing standard precautions for all patient interactions, regardless of perceived risk, represents best professional practice. This approach aligns directly with the Centers for Disease Control and Prevention, CDC guidelines, which are foundational to infection control practices in the United States and are tested on the NCLEX PN. Standard precautions are designed to prevent the transmission of infectious agents from both recognized and unrecognized sources of infection. This proactive and universal approach minimizes the risk of HAI transmission to patients and healthcare personnel, fulfilling ethical obligations to provide safe care and regulatory requirements for infection prevention. Incorrect approaches analysis. Failing to wear gloves when handling a patient's intravenous, Roman 4 line, even if the patient has no visible signs of infection, is a regulatory and ethical failure. This violates standard precautions, as blood and body fluids are considered potentially infectious. The failure to use personal protective equipment, PPE, when indicated creates a direct risk of pathogen transmission, potentially leading to an HAI and violating the nurse's duty of care. Disposing of used personal protective equipment, PPE, in a general waste bin instead of a biohazard receptacle is a significant regulatory and ethical failure. This action demonstrates a lack of understanding of proper biohazardous waste management, which is a critical component of infection control regulations. Improper disposal can lead to environmental contamination and pose a risk to sanitation workers and the public, violating public health mandates and ethical responsibilities. Washing hands only after completing all patient care tasks for the day, rather than at designated intervals, is a serious breach of infection control. Hand hygiene is the single most effective method of preventing the spread of infections. Delaying hand washing until the end of the day, especially after direct patient contact or contact with potentially contaminated items, allows pathogens to persist on the nurse's hands, increasing the risk of transmission to subsequent patients or even to the nurse themselves. This directly contravenes fundamental infection control principles and regulatory expectations for healthcare professionals. Professional reasoning. When faced with patient care situations, the practical nurse must prioritize infection control as an integral part of safe and effective care. The decision-making process should involve a constant assessment of potential risks for pathogen transmission. This includes consistently applying standard precautions, utilizing appropriate PPE, adhering to proper waste disposal procedures, and diligently performing hand hygiene at all critical junctures. The nurse must always err on the side of caution, assuming all bodily fluids are potentially infectious and implementing protective measures accordingly. This systematic approach ensures compliance with regulatory frameworks and upholds the ethical commitment to patient well-being. Question 12. Cost-benefit analysis shows that early identification of potential patient issues is crucial for optimal outcomes, but the practical nurse's role in this process is clearly defined. A practical nurse is caring for a patient who presents with new onset of shortness of breath and chest pain. The practical nurse performs vital signs, notes a rapid heart rate and low oxygen saturation, and observes the patient appears anxious. Based on these observations, which of the following actions is the most appropriate for the practical nurse to take? Option A. Report the patient's vital signs, oxygen saturation, and observed symptoms to the registered nurse or physician. Option B. Document the findings in the patient's chart and wait for the physician to assess the patient later in the shift. Option C. Ask the patient about their medical history to determine if they have a pre-existing condition that could explain the symptoms. Option D. Inform the patient that their symptoms suggest a possible heart attack and advise them to rest. The correct answer is A. Report the patient's vital signs, oxygen saturation, and observed symptoms to the registered nurse or physician. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practical nurse, PN, to interpret and act upon diagnostic information that falls outside their scope of practice. PNs are trained to collect data, report observation, and implement care plans developed by registered nurses, RN, or physicians. Making an independent diagnosis is a direct violation of these established roles and responsibilities, potentially leading to patient harm and legal repercussions. The challenge lies in recognizing the boundaries of one's professional role while still advocating for the patient's needs. Correct approach analysis. The correct approach involves recognizing the limitations of the PN's scope of practice regarding diagnosis. The PN's responsibility is to collect data, observe patient status, and report findings to the appropriate healthcare provider, RN or physician, who is authorized to make a medical diagnosis. This aligns with the Nurse Practice Act and NCLEX PN test plan, which emphasize safe and competent nursing practice within defined roles. By reporting the findings, the PN ensures the patient receives timely and accurate medical assessment and intervention from the qualified professional, thereby upholding patient safety and adhering to regulatory requirements. Incorrect approaches analysis. One incorrect approach is to independently diagnose the patient's condition based on the collected data. This is a direct violation of the PN's scope of practice as defined by the Nurse Practice Act. Diagnosing is a function reserved for RNs and physicians, and a PN performing this action constitutes practicing beyond their authorized limits, which can lead to disciplinary action, patient harm due to misdiagnosis, and legal liability. Another incorrect approach is to ignore the findings because they are not within the PN's direct diagnostic purview. This failure to report significant patient data is a breach of the nursing duty to advocate for the patient and ensure their well-being. It can delay necessary medical attention, potentially worsening the patient's condition and violating ethical principles of patient care and professional responsibility. A third incorrect approach is to discuss the findings with the patient and suggest a potential diagnosis. While patient education is part of nursing, offering a diagnosis is not. This can create anxiety for the patient, lead to self-treatment based on inaccurate information, and undermine the authority of the physician or RN who is responsible for the official diagnosis and treatment plan. It also blurs professional boundaries and can lead to misunderstandings about the PN's role. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety, adheres to the Nurse Practice Act, and respects professional boundaries. This involves 1. Recognizing the data collected. 2. Assessing if the interpretation or action required falls within the PN's scope of practice. 3. If it does not, identifying the appropriate next step, which is typically reporting to a supervisor or authorized healthcare provider. 4. Documenting the findings and the actions taken. This systematic approach ensures that patient care is delivered safely, ethically, and in accordance with legal and regulatory standards. Question 13. To address the challenge of a practical nurse, PN, encountering a patient whose condition has suddenly deteriorated with symptoms not typically managed by basic nursing interventions, what is the most appropriate course of action according to the National Council Licensure Examination for Practical Nurses Regulatory Framework? Option A. A practical nurse should continue with routine care and document the patient's symptoms without reporting the sudden deterioration, as it may resolve on its own. Option B. The practical nurse should assess the patient, recognize the need for interventions beyond their authorized scope, and promptly report the change in condition and request assistance from a registered nurse or physician. Option C. The practical nurse should immediately initiate advanced interventions and diagnostic tests that are outside the typical scope of practice for a PN, based on their best judgment of the patient's needs. Option D. The practical nurse should perform a task that is clearly within their scope of practice, but delegate it to an unlicensed assistive person, without first assessing the person's competency for the specific task. The correct answer is C. The practical nurse should immediately initiate advanced interventions and diagnostic tests that are outside the typical scope of practice for a PN, based on their best judgment of the patient's needs. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the practical nurse, PN, to exercise independent judgment within the defined boundaries of their scope of practice. The challenge lies in accurately assessing the patient's condition, recognizing when a situation requires the expertise of a registered nurse, RN, or physician, and acting appropriately to ensure patient safety and quality care. Misinterpreting the scope of practice can lead to delayed or inappropriate interventions, potentially harming the patient. Correct approach analysis. The correct approach demonstrates an understanding of the PN's scope of practice as defined by the Nurse Practice Act and relevant state board of nursing regulations. It involves recognizing the limitations of the PN's role, which typically includes providing basic nursing care, administering medications as prescribed, and monitoring patient status. Crucially, it emphasizes the PN's responsibility to report changes in patient condition and to seek assistance from an RN or physician when a patient's needs exceed the PN's authorized scope or require advanced assessment and intervention. This aligns with the ethical principle of patient advocacy and the legal requirement to practice within one's competency and legal boundaries. Incorrect approach is analysis, an approach that involves independently initiating a complex diagnostic procedure not within the PN's scope of practice, is a direct violation of the Nurse Practice Act. This constitutes practicing beyond one's authorized limits, potentially leading to patient harm due to lack of advanced training and competency. It also bypasses the established chain of command and the expertise of higher-level practitioners. Another incorrect approach, such as delegating a task that is explicitly within the PN's scope, but requires RN oversight to an unlicensed assistive personnel, UAP, without proper assessment or understanding of the UAP's competency, is also a regulatory failure. While PNs can delegate certain tasks, the delegation must be appropriate and safe, and the PN retains accountability for the outcome. Performing a task that is clearly outside the PN's scope and attempting to perform it without RN supervision or physician orders is a significant breach of professional conduct and patient safety protocols. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and adheres strictly to legal and ethical guidelines. This involves 1. Thoroughly understanding the Nurse Practice Act and facility policies regarding scope of practice for PNs. 2. Performing a comprehensive patient assessment to identify needs and potential risks. 3. Evaluating whether the identified needs fall within the PN's authorized scope of practice. 4. If the needs exceed the PN's scope, or if there is any doubt about competency or safety, immediately consulting with an RN or physician. 5. Documenting all assessments, interventions, and communications accurately. This systematic approach ensures that care is delivered safely, effectively, and within legal and ethical parameters. Question 14. The assessment process reveals a patient of a different cultural background is hesitant to make direct eye contact during the interview and provides brief, sometimes indirect answers to questions about their pain. The practical nurse needs to gather information about the patient's pain experience to develop an effective care plan. Which of the following approaches best facilitates a comprehensive and culturally sensitive pain assessment? Option A. Interpret the lack of direct eye contact and brief answers as a sign of minimal pain and document that the patient is not experiencing significant discomfort. Option B. Assume the patient's reticence indicates a lack of understanding or cooperation and proceed with a standardized pain questionnaire, encouraging them to complete it independently. Option C. Gently explain the importance of direct eye contact and clear answers for accurate pain assessment, while also asking permission to involve a family member if the patient feels more comfortable sharing with them. Option D. Focus solely on observable signs of pain, such as grimacing or guarding, and disregard the patient's verbal responses due to their perceived unreliability. The correct answer is C. Gently explain the importance of direct eye contact and clear answers for accurate pain assessment, while also asking permission to involve a family member if the patient feels more comfortable sharing with them. Explanation. The assessment process reveals a patient's reluctance to discuss personal health history due to deeply held cultural beliefs about privacy and the role of family in healthcare decisions. This scenario is professionally challenging because it requires the practical nurse to balance the need for comprehensive assessment data with the imperative to respect patient autonomy and cultural diversity, as mandated by nursing practice standards and ethical codes. The correct approach represents best professional practice because it prioritizes building trust and rapport through culturally sensitive communication. By acknowledging and validating the patient's beliefs, offering alternative methods of information gathering, such as involving a trusted family member with the patient's consent, and explaining the purpose of the information sought in a culturally appropriate manner, the nurse upholds the ethical principles of beneficence, non-maleficence, and respect for persons. This aligns with the National Council Licensure examination for practical nurses' emphasis on safe and effective patient care, which inherently includes cultural competence. An incorrect approach that involves pressuring the patient to disclose information against their cultural norms would be a failure to respect patient autonomy and dignity, potentially causing distress and damaging the therapeutic relationship. This violates ethical guidelines that prohibit coercion and mandate culturally sensitive care. Another incorrect approach, such as abandoning the assessment due to perceived difficulty, would be a failure to provide competent care and fulfill professional responsibilities, potentially leading to incomplete or inaccurate care plans and compromising patient safety. This contravenes the expectation that nurses will adapt their practice to meet diverse patient needs. A third incorrect approach, assuming all patients from a particular cultural background will behave similarly, demonstrates stereotyping and a lack of individual assessment, which is a failure in cultural competence and can lead to misinterpretations and inappropriate care. The professional decision-making process for similar situations involves a continuous cycle of assessment, planning, implementation, and evaluation, with a strong emphasis on self-awareness of one's own cultural biases, active listening, and open-ended questioning. It requires seeking clarification when cultural practices are unclear, advocating for the patient's needs within the healthcare system, and collaborating with other healthcare professionals when necessary to ensure culturally congruent care. Question 15. Market research demonstrates that practical nurses often face complex patient scenarios requiring the application of theoretical frameworks to guide care. A patient presents with significant mobility limitations and a need for assistance with activities of daily living, which major nursing theorists' contributions would be most directly applicable to developing a care plan focused on promoting patient independence and self-care. Option A. Hildegard Peplau's theory of interpersonal relations. Option B. Madeline Leininger's theory of cultural care diversity and universality. Option C. Virginia Henderson's need theory. Option D. Dorothea Orum's self-care deficit theory. Correct answer is D. Dorothea Orum's self-care deficit theory. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practical nurse to apply theoretical nursing knowledge to a real-world patient care situation. The challenge lies in identifying the most appropriate theoretical framework to guide the care plan, ensuring it aligns with the patient's unique needs and promotes optimal outcomes. Careful judgment is required to select a theorist whose principles directly address the identified patient problem and support evidence-based practice. Correct approach analysis. The correct approach represents best professional practice because it demonstrates an understanding of how major nursing theorists contribute to the development of a holistic and patient-centered care plan. By selecting a theorist whose work directly addresses the patient's identified needs, such as self-care deficits or the need for environmental adaptation, the practical nurse is employing a structured, evidence-based method to guide interventions. This aligns with the core principles of nursing practice, which emphasize the application of theory to improve patient care and outcomes, as implicitly supported by the NCLEX-BN examinations focus on applying nursing knowledge. Incorrect approach is analysis. One incorrect approach would be to select a theorist whose work is not directly relevant to the patient's presenting problem. For example, choosing a theorist focused solely on community health when the patient's needs are primarily individual and acute would be a misapplication of theory. This fails to provide a targeted and effective framework for care, potentially leading to suboptimal outcomes and inefficient use of resources. Ethically, it could be seen as a failure to provide competent care by not utilizing the most appropriate theoretical lens. Another incorrect approach would be to choose a theorist based on personal preference or familiarity, rather than the direct applicability to the patient's situation. This prioritizes subjective bias over objective assessment and evidence-based practice. Such an approach deviates from professional standards that mandate the use of theoretical frameworks to enhance the quality and effectiveness of nursing care. Regulatory guidelines for practical nursing emphasize the importance of critical thinking and evidence-based decision-making, which this approach neglects. A third incorrect approach would be to disregard the use of any nursing theory altogether, relying solely on intuition or basic task-oriented care. This fails to acknowledge the foundational role of nursing theory in shaping professional practice and advancing the discipline. It limits the nurse's ability to critically analyze patient situations, develop comprehensive care plans, and contribute to the scientific basis of nursing. This approach is contrary to the expectations of professional nursing licensure, which requires the application of theoretical knowledge. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough patient assessment to identify key needs and problems. Next, they should consider various nursing theories and evaluate their relevance to the identified patient issues. The chosen theory should then guide the development of nursing diagnoses, goals, and interventions, ensuring that the care plan is comprehensive, individualized, and evidence-based. This systematic approach ensures that theoretical knowledge is effectively translated into high-quality patient care. Question 16. Operational review demonstrates that a patient, previously competent and with a clear advance directive stating a desire to refuse blood transfusions, is now being visited by their adult child who insists that the nurse administer a blood transfusion, stating the patient would want this now. The patient is currently awake but appears disoriented. What is the practical nurse's most appropriate initial action? Option A. Proceed with the current care plan without acknowledging the adult child's request, as the patient's advance directive is clear. Option B. Immediately administer the blood transfusion as requested by the adult child, assuming the child is acting in the patient's best interest due to the patient's disorientation. Option C. Attempt to speak directly with the patient to assess their current wishes and decision-making capacity, while also acknowledging the adult child's concern. Option D. Gently explain to the adult child that the patient's advance directive is legally binding, and that the nurse cannot administer a transfusion against the patient's documented wishes without a court order or a change in the patient's expressed wishes while competent. The correct answer is D. Gently explain to the adult child that the patient's advance directive is legally binding, and that the nurse cannot administer a transfusion against the patient's documented wishes without a court order or a change in the patient's expressed wishes while competent. Explanation. This scenario presents a professional challenge rooted in the conflict between a patient's expressed wishes and the perceived best interests of the patient, complicated by the involvement of a family member who may or may not have legal authority. The practical nurse must navigate the principles of patient autonomy, beneficence, non-maleficence, and justice, all within the framework of the Nurse Practice Act and ethical codes governing practical nursing in the United States. Careful judgment is required to uphold patient rights while ensuring safe and ethical care. The correct approach, which involves clarifying the patient's current wishes and assessing their capacity to make decisions, represents best professional practice because it prioritizes patient autonomy. The Nurse Practice Act and ethical guidelines emphasize the patient's right to self-determination. By directly engaging the patient and assessing their decision-making capacity, the nurse upholds the principle of informed consent and respects the patient's right to refuse treatment, even if that decision is not what the family or the nurse might prefer. This aligns with the ethical obligation to do no harm, non-maleficence, by avoiding unwanted interventions. An incorrect approach that involves immediately complying with the family member's request without verifying the patient's current wishes or capacity would be a significant ethical and regulatory failure. This violates the principle of patient autonomy and could lead to battery or other legal ramifications if the patient is competent and has not consented to the proposed action. It also fails to uphold the nurse's duty to advocate for the patient. Another incorrect approach, such as ignoring the family member's request and continuing with the current care plan without further assessment, fails to address a potential change in the patient's condition or wishes, and neglects the nurse's duty to communicate and collaborate. While not as egregious as overriding a competent patient's wishes, it can lead to suboptimal care and a breakdown in communication. A third incorrect approach, which involves immediately seeking legal counsel without first attempting to clarify the situation with the patient and family, is premature and may not be necessary. While legal consultation is important in complex situations, the initial step should always be to gather information and assess the patient's status directly. This approach bypasses the nurse's primary responsibility to the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient. Directly communicate with the patient to understand their current wishes, concerns, and level of understanding. 2. Determine capacity. Evaluate the patient's ability to understand the information relevant to their care and to communicate their choice. 3. Identify legal authority. If the patient lacks capacity, determine who has legal authority to make decisions on their behalf, e.g., through a durable power of attorney for healthcare or guardianship. 4. Communicate and collaborate. Discuss the situation with the patient if capable, the family, and the healthcare team. 5. Document. Thoroughly document all assessments, communications, decisions, and actions taken. 6. Seek guidance if uncertainties remain. Consult with a supervisor, ethics committee, or legal counsel. Question 17. Consider a scenario where a newly licensed practical nurse is reviewing historical nursing textbooks from the early 20th century for a continuing education module on the evolution of patient care. The nurse encounters descriptions of nursing interventions that are now considered outdated or even harmful by current standards. When discussing patient care with a preceptor, the nurse expresses confusion about why these historical practices were ever considered acceptable. Which of the following responses from the preceptor best reflects an understanding of the historical context while reinforcing current professional standards? Option A. The preceptor dismisses the historical texts, stating that they are irrelevant to modern nursing and that the focus should solely be on current protocols and technologies. Option B. The preceptor advises the nurse to focus on memorizing current procedures and not to waste time on historical information that is no longer applicable to practice. Option C. The preceptor explains that while historical practices were different due to limited scientific understanding and resources, current nursing practice is guided by evidence-based research, regulatory requirements like the Nurse Practice Act, and ethical principles to ensure patient safety and optimal outcomes. Option D. The preceptor suggests that some of the older methods might still have merit in certain situations, as they were used by experienced nurses of the past. The correct answer is C. The preceptor explains that while historical practices were different due to limited scientific understanding and resources, current nursing practice is guided by evidence-based research, regulatory requirements like the Nurse Practice Act, and ethical principles to ensure patient safety and optimal outcomes. Explanation: this scenario is professionally challenging because it requires the practical nurse to navigate the evolution of nursing practice and its historical impact on patient care standards, while adhering to current regulatory expectations. Understanding the historical context helps in appreciating the development of evidence-based practices and the rationale behind current protocols, but it must not supersede contemporary legal and ethical mandates. The correct approach represents best professional practice because it prioritizes current, evidence-based nursing interventions and adheres strictly to the Nurse Practice Act and other relevant state regulations governing practical nursing. This ensures patient safety, promotes optimal outcomes, and maintains professional accountability. The historical perspective informs understanding, but does not dictate current practice when superseded by established regulations and scientific advancements. An incorrect approach that relies solely on historical methods without considering current evidence-based practices or regulatory requirements fails to meet the standard of care expected of a licensed practical nurse. This could lead to suboptimal patient outcomes and potential harm, violating the ethical principle of non-maleficence and the legal duty to provide competent care as defined by the Nurse Practice Act. Another incorrect approach that dismisses the value of historical context entirely might overlook valuable lessons learned from past practices that, while not directly applicable, could offer insights into patient responses or the evolution of care philosophies, potentially hindering a holistic understanding of patient needs. However, the primary failure in such an approach is not prioritizing current standards. Professionals should approach such situations by first identifying the current, legally mandated standards of care and evidence-based practices. Then, they should consider how historical perspectives might inform their understanding of the patient's condition or the evolution of treatment, but always within the framework of current regulations and patient safety. This involves critical thinking, continuous learning, and a commitment to ethical practice, ensuring that decisions are grounded in contemporary knowledge and legal requirements. Question 18. The investigation demonstrates that a practical nurse is caring for an elderly patient who has expressed a clear desire to refuse a prescribed medication that the nurse believes is crucial for managing the patient's chronic condition and preventing serious complications. The patient states they feel fine and do not want to take more pills. What is the most appropriate course of action for the practical nurse in this situation? Option A. Document the refusal and immediately report the patient to social services for suspected elder abuse or neglect due to their decision. Option B. Document the refusal and then ignore the patient's wishes, proceeding to administer the medication as prescribed without further discussion. Option C. Gently explore the patient's reasons for refusing the medication. Assess their understanding of the medication's purpose and potential consequences of refusal, and discuss alternative strategies or concerns with the patient, involving the healthcare provider as needed. Option D. Administer the medication forcefully, explaining that it is for their own good and that they have no choice in the matter. The correct answer is C. Gently explore the patient's reasons for refusing the medication. assess their understanding of the medication's purpose and potential consequences of refusal, and discuss alternative strategies or concerns with the patient, involving the healthcare provider as needed. Explanation. The investigation demonstrates a situation where a practical nurse is faced with conflicting ethical principles, specifically beneficence and autonomy. In the context of patient care, the challenge lies in balancing the nurse's duty to act in the patient's best interest with the patient's right to make their own decisions, even if those decisions appear detrimental. This scenario requires careful judgment to uphold professional standards and patient rights. The correct approach represents best professional practice because it prioritizes patient autonomy while still ensuring the patient receives necessary information and support. This aligns with the ethical principle of respect for persons, which is fundamental in nursing practice and is reflected in the Nurse Practice Act and the American Nurses Association ANA Code of Ethics. By engaging in open communication, assessing the patient's understanding, and exploring alternatives, the nurse upholds the patient's right to self-determination while fulfilling their duty to advocate and educate. An incorrect approach that involves overriding the patient's decision without further exploration or consent violates the principle of autonomy. This could be seen as paternalistic and may breach the patient's trust, potentially leading to a breakdown in the therapeutic relationship. Such an action could also contravene regulations that mandate informed consent and patient rights to refuse treatment. Another incorrect approach, such as abandoning the patient or reporting them to authorities without attempting to understand their reasoning or provide support, fails to uphold the ethical duty of non-maleficence, do no harm, and beneficence. It also neglects the nurse's role as an advocate and caregiver. This approach demonstrates a lack of professional judgment and an inability to navigate complex ethical dilemmas, potentially violating professional conduct standards. A further incorrect approach, such as proceeding with the patient's wishes without ensuring they fully understand the implications or exploring their motivations, neglects the nurse's responsibility to ensure informed decision-making. While respecting autonomy, the nurse also has a duty to ensure the patient's choices are based on accurate information and a clear understanding of potential consequences. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ethical dilemma. 2. Gather all relevant information about the patient, their condition, and their wishes. 3. Identify the ethical principles in conflict. 4. Explore the patient's values, beliefs, and understanding. 5. Discuss options and potential consequences with the patient. 6. Consult with colleagues or supervisors if necessary. 7. Make a decision that respects patient autonomy while upholding professional responsibilities and ethical standards. Question 19. Upon reviewing the care plan for a patient who is scheduled to receive a routine medication, the practical nurse hears the patient verbally state, "I don't want that medicine today." Which of the following actions best demonstrates adherence to fundamental concepts of nursing practice and patient rights? Option A. Immediately notify the healthcare provider of the refusal and await further instructions without engaging the patient further. Option B. Administer the medication as prescribed, assuming the patient will eventually understand its importance. Option C. Document the patient's refusal and leave the medication at the bedside for them to take later if they change their mind. Option D. Gently explain the purpose and benefits of the medication again, assess the patient's understanding of the information, and inquire about their reasons for refusal, documenting the conversation and the patient's decision. Correct answer is D. Gently explain the purpose and benefits of the medication again, assess the patient's understanding of the information, and inquire about their reasons for refusal, documenting the conversation and the patient's decision. Explanation. The scenario presents a common challenge in practical nursing, balancing the need for patient autonomy with the nurse's responsibility to ensure safety and adherence to the care plan. The professional challenge lies in interpreting a patient's verbal refusal of a prescribed intervention, which is a fundamental aspect of patient rights and nursing ethics, while also considering the potential consequences of that refusal for the patient's well-being and the integrity of the prescribed treatment. Careful judgment is required to assess the patient's capacity to refuse, the nature of the intervention, and the potential risks and benefits. The correct approach represents best professional practice because it prioritizes patient rights and ethical considerations as mandated by nursing practice standards and regulations. Specifically, it aligns with the principle of informed consent, which requires that patients have the right to accept or refuse medical treatment after being adequately informed of the risks, benefits, and alternatives. This approach also reflects the nurse's duty to assess the patient's understanding and capacity, ensuring that any refusal is a knowledgeable and voluntary decision. Adhering to these principles upholds the patient's dignity and promotes a therapeutic relationship built on trust and respect, which are core tenets of practical nursing as outlined by the National Council of State Boards of Nursing, NCSBN, practice standards. An incorrect approach that involves proceeding with the intervention, despite the patient's verbal refusal, represents a significant regulatory and ethical failure. This action violates the patient's right to self-determination and bodily integrity, potentially constituting battery. It disregards the fundamental principle of informed consent and demonstrates a lack of respect for patient autonomy. Such an action would be a direct contravention of the NCSBN Code of Ethics for Nurses and could lead to disciplinary action, including license revocation. Another incorrect approach, which involves immediately documenting the refusal without further assessment or communication, also presents professional challenges. While documentation is crucial, a passive approach that does not involve further assessment of the patient's understanding, the reasons for refusal, or potential alternatives fails to fulfill the nurse's duty of care. The nurse has a responsibility to explore the patient's concerns and to advocate for their needs, which may involve re-educating the patient or consulting with the healthcare provider. Simply documenting the refusal without further engagement can lead to suboptimal patient outcomes and may not fully address the underlying issues contributing to the refusal. The professional decision-making process for similar situations should involve a systematic approach. First, the nurse must assess the patient's capacity to understand the information and make a decision. This includes evaluating their cognitive status and the clarity of their communication. Second, the nurse should explore the patient's reasons for refusal, actively listening to their concerns, and providing clear, understandable information about the intervention, its purpose, potential benefits, risks, and alternatives. Third, the nurse should document the patient's refusal, the assessment of their capacity, the information provided, and any discussions held. Finally, if the patient continues to refuse and has the capacity to do so, the nurse should communicate this to the healthcare provider and document the plan of care accordingly, ensuring the patient's wishes are respected within the bounds of safety and professional standards. Question 20. Process analysis reveals that a practical nurse administered a prescribed medication to a patient and intended to document the patient's subsequent vital signs and subjective response. However, due to a distraction, the nurse failed to immediately record this crucial information in the patient's electronic health record. Later, upon realizing the omission, the nurse needs to ensure the record is accurate and legally sound. Which of the following actions best represents professional nursing practice in this situation? Option A. Decide that since the patient is stable, the omission is minor and does not require any further documentation. Option B. Add the missing vital signs and subjective response as a late entry, clearly indicating the date and time of the entry and that it is a late addition. Option C. Erase the original entry for the medication administration and rewrite it with the vital signs and subjective response included. Option D. Document the missing vital signs and subjective response in a separate, new note without referencing the original medication administration entry. The correct answer is B. Add the missing vital signs and subjective response as a late entry, clearly indicating the date and time of the entry and that it is a late addition. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a critical documentation error that has direct legal and ethical implications. A nurse's failure to accurately record a patient's response to medication could lead to misinterpretation of the patient's condition by other healthcare providers, potentially resulting in inappropriate treatment or delayed intervention. This directly impacts patient safety and the integrity of the medical record, which serves as a legal document. Correct approach analysis. The correct approach involves immediately correcting the error by adding the omitted information to the patient's record. This action upholds the principle of accurate and timely documentation, which is a cornerstone of professional nursing practice and a legal requirement. By adding the information as a late entry, the nurse acknowledges the omission and ensures the record reflects the patient's actual status and the nurse's actions, thereby maintaining the legal defensibility of the record and promoting continuity of care. This aligns with the nurse practice act's emphasis on accurate record keeping and professional accountability. Incorrect approach is analysis. Failing to document the patient's response to medication entirely is a direct violation of documentation standards and patient safety principles. This omission creates a gap in the patient's record, making it impossible for other healthcare providers to assess the full impact of the treatment, potentially leading to adverse events. Legally, an incomplete record can be interpreted as evidence of substandard care. Attempting to alter the original entry by erasing or overriding the existing information is a serious ethical and legal violation. This constitutes falsification of a medical record, which can have severe consequences, including disciplinary action by the Board of Nursing, civil lawsuits, and even criminal charges. It undermines the integrity of the healthcare system and erodes trust. Documenting the omitted information in a separate, unsynchronized note without clearly linking it to the original entry or indicating it as a late entry can also lead to confusion and misinterpretation. While it attempts to capture the missing data, it fails to maintain the chronological integrity and clarity of the patient's record, potentially creating ambiguity about when the information was actually recorded and observed. Professional reasoning. When faced with a documentation error, a nurse should follow a systematic approach. 1. Recognize the error. 2. Immediately take steps to correct the error in a manner that preserves the integrity of the record. 3. If the error involves an omission, add the missing information as a late entry, clearly identifying it as such and dating/timing it appropriately. 4. If the error involves an incorrect entry, follow facility policy for corrections, which typically involves a single line through the incorrect entry, writing error or mistaken entry, and initialing and dating the correction. 5. Report the error to the supervisor if required by facility policy or if the error has significant implications for patient care. 6. Reflect on the incident to prevent future errors.